late morning. My eyes started to hurt. It felt like there was something in my eye. It started getting more painful as the day went on and more red. Like I couldn't see if there was, I didn't know what was going on. Overnight, my left eye is like totally blurry. It's like a coat of like smog over my eye. And so I can't see out of my left pretty much at all.
So Arya came to us this afternoon. As he mentioned, he had basically about a week, about 4 to 5 days of progressive blurry vision and pain in the left eye. And his vision has gotten progressively worse despite using antibiotic eye drops. He did disclose to me that there might have been times where he was sleeping in his contacts. And that is a huge risk factor, unfortunately, for this type of problem, because there's some bugs and bacteria that really like moisture, and contact lenses can trap moisture under the lens between the eyeball and the lens cornea, and that can create a perfect breeding ground for infectious keratitis and a particular bug that is quite concerning called Pseudomonas, which I suspect this gentleman has. Basically, our task is to confirm that diagnosis. So even though you've been on antibiotics for a period of time, we're going to reculture the eye. We're going to do that now. We'll demonstrate how that's done. And then we're going to start treatment with what we call fortified antibiotics, which is a stronger version of the antibiotics that you're currently using. And we're going to double the dose and frequency as well. So you'll be using those every hour around the clock for the first 48 hours. And then we'll follow you very, very closely. So I'm going to give you a little numbing drop here. Look all the way up. Perfect. So proparacaine is a little bit better to use than tetracaine. It tends not to be quite as abrasive, and it tends to preserve the bacteria. It doesn't kill out the bacteria as much as tetracaine, but nonetheless, that is something that you just have to kind of, weigh the risks of. But generally, if you don't numb the eye, it's going to be quite uncomfortable getting the cultures. So to do a culture, you basically have different plates for different types of bacteria. And we have a fungal swab as well. But basically we got a blood culture, we have a chocolate, and we have thio. All of these are used for anaerobes, aerobic bacteria, as well as fungal cultures, and what we call gram-positive and gram-negative. So it kind of covers the whole gamut, and we use a special spatula that's actually made of platinum called a Kimura spatula. And the platinum is nice because it heats very quickly and cools very quickly, so that we can sterilize it between sessions and make sure that we're only treating and only culturing what's on his eye, not what's lingering on the bowel. Move it up a little bit. You can see that thickening of the cornea, as well as what we call infiltrate, which is whitish areas right under the epithelium. And there's some folds or wrinkles that are suggestive of edema or swelling, so kind of a long-ish term infection. And there's even some areas on the periphery of the cornea, some peripheral infiltrates that are almost like these little kind of satellites. They're kind of hard to see.
Want to turn the light off?
Yeah, let's see. So yeah, there's a little. All right, so let's go ahead and sterilize this thing. Nice. You just get it kind of hot. And it cools pretty quickly. Yep, so we do blood first. Both eyes open. Alright, good. Okay, perfect. Don't move. Keep them right there. And we just scrape. We want to avoid the lashes and the lid. Removing epithelium is actually a good thing. It helps expose the area for the antibiotic. Make little C patterns so that the pathologist can know that it's corneal tissue. Good. And once again, get rid of some of that epithelium out here. And just back and forth. And then we'll just do the same thing. Little C's. Now for the thio and for the fungal plate, I basically take a clean cotton swab, take a one more time. Okay. Both eyes open. Very good. Stay right there. And just kind of roll this up. Okay. And then you try not to touch the edge. Take it out. And just drop it in. Alright, and one last time, both eyes open. Open as wide as you can. There you go. Great. And we'll label that, and we'll send those off to the lab. We usually get results in about 5 to 7 days. Fungal cultures take a little bit longer. And then we should get some sensitivities back if anything grows, and that'll help us tailor our antibiotic treatment. Right now, we're gonna give him everything. We're gonna give him fortified antibiotics, vancomycin, tobramycin, eye drops, as well as a subconjunctival gentamicin. That'll be double coverage for Pseudomonas between the tobra and the gent. And then we'll get the cultures back, God willing, and then we'll be able to see what sensitivities are actually there, whether or not this is what we suspect or something else, and then we'll alter our treatment, okay? So the last thing is gonna be this injection of antibiotics, okay?
Okay.
All right, perfect. Now this we can use tetraene, it's fine. Good, look all the way out. One more time. Good, blink. Perfect. Good, don't move. Stay right there. All right, D, can you press that in?
Keep your hand forward.
There you go, perfect. Keep going. Beautiful. Beautiful. Good little swing. Excellent. Good, look up. That's it. Okay, close your eyes, just relax. Feeling okay? Good. All right, you sit back for a second. You did it more numbing. And you can drop a baby down as well. Okay, both eyes open. Sorry, the numbing will help.
Okay, thanks so much.
How are you feeling?
Okay.
I'm sorry. He's like,
Never
turn this
felt better."
camera off, please.
That's okay, that's okay.
Give me a drink.
Okay,
Yeah.
good. All right, we give you some betadine that'll just
Okay.
kind of clean everything off, and you know, again, it's an antiseptic in and of itself, so that's a good thing to add too. It just burns. Good. Close your eyes. Keep your eyes closed. Look up, down, left, right. Let it kind of wash around. All right, and we'll follow you pretty closely. Okay. So I'll see you back in like a day or two.
Okay.
We don't always see improvement in the first 48 hours. I just want to make sure things aren't getting worse. These types of infections kind of, the analogy is like slowing a freight train. Like it doesn't take, you apply the brakes today, but it takes some time for things to really start to turn around. But we'll be kind of watching everything. We kind of measured the area of the infection, and we took some pictures today, obviously, and we'll be tracking that through the next week, okay? So follow you pretty closely, and then once we get the cultures back, we'll make some adjustments with the medication. All right, do you have any
Sounds
questions?
No, just take the medicine. You whatever, I pick it up.
Yeah, so I'm going to send it to a specialty pharmacy, and we'll
Okay.
probably call you in about an hour to have that ready for you. Okay? All right.
Thanks so much.
Good luck. Of course, you're
Thank you.
welcome.